care.
It's important for patients to understand in their particular case what's keeping them from getting pregnant, what the treatment options and odds are, and let them make an intelligent choice. The main thing is to involve everybody and involve the whole couple. This is a very, very stressful process. Patients tend to want to look for things as a quick fix and say, "Oh, we found one thing and we're going to treat it." The vast majority of couples that we deal with don't have one absolute factor that's keeping them from getting pregnant, but have multiple factors that combine together decrease their overall chance of success.
The number one goal of a patient trying to get pregnant, or a couple trying to get pregnant, is success. So you have to be able to provide that. And we have a long track record of providing success. The success, though, has to come with both safety and also respecting their own personal desires and their own background and understanding where they come from. Some patients are comfortable with the more invasive high-tech procedures. Some patients want to go more natural, lower-risk procedures. So individualizing for that individual, maximizing both their success and their safety, and then also being respectful of who they are and where they come from.
As a doctor, I like to look at all the old records, all the surgeries, all the fertility treatments they've had, and then go over with them not only what they have done, but what the chances are of pregnancy, what I think is keeping them from getting pregnant, and what the treatment options are. And I think as long as couples understand what the chances are, what the options are, and I think those couples I always find are least stressful patients because they know, what's the next step.
My desire for each couple is to help them understand how I can help them in their desire to have a pregnancy, because not every couple, besides wanting to get pregnant, is really planning to do it the same way. Some of them have personal issues. There could be moral issues, ethical issues, financial issues. They all decide along the way with the options that we can give them what their best plan is going to be.
I like to be accessible for my patients. My patients, those who undergo in vitro fertilization, are going through a lot of complex issues, medical, emotional, and they can reach me anytime they want, even though I may not be on call. But they have access to me, they have my patient numbers, and I do answer their emails. I don't put medical information on the email, but I use that to communicate. If they have any questions, they email me, and I'm happy to pick up the phone in between patients and talk to them.
My objective is to give them a fair assessment of reasons why they may be having infertility problems, and then to provide them information on the infertility issues that they may be facing, to give them options of treatment for infertility with the success rates that they may be facing for those different options, and to provide medical care to help them go through infertility treatment. Of course, I would love for each and every person that walks through my door to become pregnant. If they are pregnant, it's a wonderful thing. If they're not pregnant, I still hope they had a good experience here with us at Fertility Specialists.